push my button. Push my button. Good morning, everybody. Nikki Burnett here, Taste Life Nutrition. This is Taste Life Nutrition Radio, streaming live on KUHSdenver.com. In my opinion, the best station ever created. Thanks to Henry. Got to throw it out there. So this is Taste Life Nutrition Radio, and what are we about? We are about, I forgot to see, every time I forget to push my buttons. I told you I messed it up, and I don't turn my stuff on. And so, sorry guys, this is just me. I was out all last week, and so I am discombobulated. So, anyway, here we go again. Taste Life Nutrition Radio is all about bringing you health, truth in healthcare, and hopefully maybe expanding what you know to be true about healthcare. We believe that healthcare is all-encompassing. It is relational, it's physical, it's mental, it's emotional, it's spiritual, it's financial, right? And so what we want is to bring you the truth to the best of our knowledge, and maybe thinking outside the box a little bit. You know, instead of just saying if something's happening, I need to go see my doctor. Maybe there are other things that can be done. Not that that's a bad thing. Got to have your doctor on your team. But there's lots of goodness, lots of amazing people out there who are working their tails off to bring you good health, a good life, and help bring you the ability, help you live to the best of your ability and the biggest, most optimal life you have. Because I believe that we're all here to do big, big things. And that's what I'm trying to do. And that's what I know Dr. Isaac is trying to do. And I know that we're all trying to work together to help bring goodness to the world and have some freaking fun at the same time. So, without a doubt, now we have Dr. Isaac Mooberry, who is a brain-based chiropractor. And I'm going to let him talk to you about what that means here in a little bit. But this is one of my favorite forms of chiropractic because it's not, you know, so much of what we know and so much what can get a bad rap is it's just snap, crackle, pop, and it's scary, and it's really not. I love the snap, crackle, pop. I think it's amazing. But there's more to it. There is more to understanding the brain, understanding neurological factors involved and how they can affect the mind, the body, the soul, the thoughts, all of the things. And so, thank you for being here.
Thanks for having me.
Yeah, I'm
Definitely.
super excited. This is going to be a good talk. We've been waiting for this it's been a couple of months now. And it always seems like it takes forever for it to actually finally get here. And so it's finally here. But of course, as always, we start the show with gratitude, because gratitude can change the world. Yes, it can. And I mean that seriously, because really, if we focus on all of the goodness, and there's so much goodness, it helps to kind of mute the badness a bit, because it's always going to be there. You don't know what's good if there's not bad. But focus on the good, be grateful. I start my day with gratitude. I do my visualizations, I do my prayer, I do my meditation, and it really is lifting. It brings me up, and it can bring the world up. Everybody around you, that energy will permeate. So, what are you grateful for?
I am definitely grateful for being here. I feel in select companies, because I know you typically have female
it's true.
entrepreneurs on.
It's true.
So
Not intentionally. It's just the way it goes.
Yes. So I'm definitely grateful for that. But yesterday afternoon, I just felt really on fire. So that was awesome. And then
On fire about what you do?
Yeah, I mean, just like the interactions in the office were great. And I know sometimes, I don't know about you, but sometimes you feel like, hey, I'm good. But then there's other times where you feel like you're a notch above that. And that was yesterday afternoon, which was, I don't know, it was empowering. And I don't know if it was like getting ahead of the snowstorm that came in last night up in Evergreen where I live. But yeah, it's definitely a blessing to be here. So thank you.
Yeah, no, that's amazing. It is fun to feel the fire. And the fire, I think, for most of us who do what we do, and probably anybody out there who's really excited about their world, the fire's always there, but when it's ramped up, you're like, this is amazing, and it feels so good. So I get you.
Definitely.
Yeah, that's amazing.
Yes.
So I am grateful for the opportunity to go to Michigan and see my family, which is super cool. It was an interesting sort of bittersweet situation, as those who watch the show regularly know. Right about this time last year, I lost my mom, and up in Michigan is my whole mom's side of the family. And so it's my first time ever to be there without her. Woo! It was this amazing, beautiful experience because my second cousin was getting married. I remember the day she was born. She's beautiful. It's so sweet, and I love it. And everybody was there and happy. And I'm like, why isn't my mom here? And she was. I truly believe that she was. But you know, it was a great thing to be able to spend time with them. I don't get to see them as much as I'd like to. They're such amazing, good-hearted, quality people. And so, if any of you are watching, I love you. Such a good time. So, got to spend a full week there. It was good stuff. So, that's what I'm grateful for. Good family, good friends, good life, all of the good things. So,
I also want to add in a happy belated anniversary.
Oh, God, thank you.
Yes.
So the day my second cousin got married was also my anniversary. So, wow, nice job. So my 17th anniversary, which is
awesome.
Kind of amazing.
Yeah, we're on 16.
Are you?
Yes.
It's crazy that it just is like, it was just yesterday, and now the wrinkles and the gray setting in. I mean, I don't know. But it's good. It's a good life. It's a good thing to have your partner with you through life. You know,
yes.
It's pretty fun stuff. So it kind of stunk to not be there with him, but we celebrated the weekend before. Maybe we'll celebrate again this weekend. I'll celebrate every day. So
excellent.
Cool. So I think at this point, let's get into all about Dr. Isaac. You know, and I like to hear your history, but what excites you, what motivates you, what brought you here is, you know, it's kind of the typical things that we do, but, you know, there are things that light us on fire, kind of like yesterday. So what does that look like for you?
Well, I guess my evolution into where I'm at now started as a child. I was fishing in a stream. I fell on my butt on a rock.
Oh.
And I went home, told my mom my back was hurting, and this was probably when I was about 8 years old. And from there, she took me to a chiropractor, and through playing sports growing up, basketball and soccer as a goalie, so I'd be diving all over the place. I'd have episodic issues where we'd go in, I'd experience some relief. Probably much like most people in America or in the world that do go to chiropractors, they utilize it for. And so I didn't know what I wanted to do with my life, and I was in college, and I was indecisive, like I think so many people are. And I was back home for a Thanksgiving break, and my brother's soccer coach at the time was a recent chiropractic graduate, and I chatted with him. I was like, I should go talk to my family chiropractor. And so through doing that, I was like, hey, I can help people naturally. I can be my own boss. I don't have to worry about my job being outsourced overseas. This is totally non-invasive, and I get to help people. And so that's what led me to choosing chiropractic and kind of streamlining to get all my prerequisites that I needed through my undergraduate and an additional 4 years of graduate school after that to get the chiropractic degree. And a lot of people don't know this, but the chiropractic education and medical doctor education is almost identical. The only difference is there isn't the pharmaceutical side of things with chiropractic, and so we get more of the neurology and the biomechanics of how the body is working. And we also get nutrition, and so
that does not seem much in conventional medicine.
No, not at all. I think when I was in school, we had I can't remember how many hours we had, at least 40 or so hours of nutrition.
Amazing.
I believe. But at the same time, the medical profession, I believe, in their education was receiving like 2 hours, right? And so there's definitely that factor that we'll get into here later. But so then I graduated, innately from what I guess in a deeper core level of my being, I felt like there was more than what I was seeing or hearing in chiropractic school, because I was hearing about moms and dads bringing their kids in that had ear infections, that had colic, that moms were coming in when they were pregnant. It wasn't just about neck pain and back pain, which was why I utilized it, right? And I think that's where a lot of the population, they think of it in that extent as well, in a very westernized way versus it being more of a holistic way of optimizing and being proactive to help your body be the best it can be. And so I started off my career, and it was more in that sports injury pain rehab focus, and then my own experience led me to changing what I ended up doing for myself as well as my patients. But it was about 4 years into my career that I developed severe back pain, where for about 5 to 6 weeks I barely could get my shoes and socks on, could barely put my pants on, I couldn't even really pick up my daughter and play with her because of how severe my back pain was. I was like, can I even continue to keep being a chiropractor? This is not good. I mean, this is what I'm supposed to be helping people with, and I'm having these challenges. And so a dear colleague of mine, Dr. Tim Murphy, he's in Aurora, he showed me what I've been doing, had been utilizing chiropractic essentially as an expensive ibuprofen. Right, I was only addressing the pain whenever it come about, and now it's actually even worse than it's ever been before. And so through changing how I addressed my body, I saw that I needed to do more things outside of just when I had pain. I needed to stay on top of things and be proactive. And so I started changing my philosophy with how I address my patients. And that's led me to where I'm at now. And so with that, it's, my biggest mission right now is to reach into the public and at least provide people knowledge so they can be empowered to know that they have opportunities and what those opportunities or options may be, right? And maybe it's not the right fit for us and them at that moment, but now they've at least been exposed to it, so they can start thinking about things maybe differently than they have before. Because a lot of times I think people, when they go see a doctor, they're not empowered. They feel like this person has the only solution for me, and maybe it doesn't resonate, but I feel like this is the only thing, so I have to do this. Or I'm not getting the results, but they tell me, well, try this instead. I'm like, well, still not getting the results. Why is this not working, right? And so I want to empower people in our community to be able to know they can be proactive. They don't have to be reactive like medicine's taught us to be in America. And so you can have more years in your life and get more life out of those years as well. It's
empowering, and I think that's the goal of this type of healthcare, is to make sure that we are empowered and that we're making sure that those who we work with, whether it's one-on-one or through videos and channels like this, to know that empowerment is what allows you to move forward and not giving that power away. And I think a lot of times when we don't know what avenue to take, and we do just go to one person or one type of care or whatever the case may be, we see that as they're the only answer, and that gives the power away, and so you have the power to, this is what I like to talk about a lot, is building your team and making sure that you, even if you don't use them all the time, the people who are there to support you, to help you, to guide you, to help you fix you, whether it's biochemically, biomechanically, mentally, emotionally. We need help for all of those things. For me, financially, I need a bookkeeper that helps me. So it's having your team of people who are on your side and are going to give you the good information, empowers you to make the right decisions for your care and for your future and for your family. And I think that that's super important. So
definitely, yes.
Cool. Go ahead.
So yeah, I mean, I gave the title of what I want to talk about today, regenerative medicine. I mean, that's such a big craze right now, right?
And it's broad.
It is very broad. I mean, whether it's aesthetics or internal side of your body or joints, wherever it might be, and but oftentimes you don't have to wait to be totally broken before you do something. Get proactive, right?
Yeah.
I mean, there's those Costco-sized bottles of ibuprofen out there. It's like, oh my gosh. I mean,
Yeah.
if I think I just had a dental procedure,
Mhm.
and I used some ibuprofen for that, and that was the first time I think I've used ibuprofen in like over 2, 3, 4 years.
I think
Right.
that, not to get off on a tangent, but there's such a lack of understanding because it's so promoted, it's so advertised, it's so, we need the pill to fix our issue, that we see ibuprofen, things like ibuprofen, as being okay, being healthy, being an answer. And sometimes for a short period of time it can be, but it's pretty dangerous, and it's really dangerous. And I've had clients come to me who are taking it every day. Some of them don't even know why they're taking it. Some of them do, and it helps them, but it's not getting to the root cause, which is what we're going to say on this show every single day that we have a show, is get to the root cause of whatever the dysfunction, the pain, the inflammation, whatever is going on. Get to the root cause so you don't have to depend on things like ibuprofen, except for situations where you have a tooth surgery.
Yeah, indeed. I avoided a root canal, which was great, but
Good.
definitely having your jaw cranked on for multiple hours, and
yeah.
it's like, oh my gosh.
Yeah.
So,
well, we should have a show about root canals.
Oh yeah, definitely. I mean, holistic dentistry is a
Yes.
thing out there. So if you haven't heard of
Yes.
it, definitely look into it.
It's
Get the
amazing.
silver and mercury out of your mouth.
Yeah.
And we'll get into heavy metal poisoning, but I think there's a lot of things that people aren't even aware of.
Yeah.
That there's a different alternative out there, and the best way, I think, is when you hear a recommendation or you get advice, is to look into it yourself. I mean, empower yourself to think critically about what's being offered. And so, but to just kind of get into the meat and potatoes of what we're going to talk about, there's definitely really great things out there that are coming out with regenerative medicine that can be very helpful for people to avoid a surgery potentially, which is, in my personal opinion, there's definitely a time and place for drugs and surgeries, but I'd say probably 90% of the time they're way overprescribed and done, where you could be proactive, you can change your lifestyle. 80-90% of the diseases in the world are lifestyle caused.
Yep.
And so, there's something called Morton's jelly that is mesenchymal signaling cells that it's essentially what stem cell used to be considered, but now with the research they're realizing it didn't actually do what they thought it did. It does something different, where it's donating mitochondria to like damaged mitochondria in your cells.
I didn't know that.
Yeah.
That's
so
amazing.
And then there's also peptides. The BPC157 is a peptide that's used a lot in regenerative medicine as well, and it's showing a lot of promise out there. A lot of anecdotal evidence with a number of people receiving great benefit. I think they're in the middle of doing some trials so they can actually back that up. But
cool.
yeah, so there's a lot of great things out there that maybe people have heard of. But if you're not broken, don't wait till you're broken, right? Get ahead of the curve. And so we have a very reactive approach to medicine in our society.
Yes.
Unfortunately, from what we've been educated on through the media and the commercials and everything that we see, we think we can dance off into the sunset with the loved one if we just take a pill. And
it is. It's really heartbreaking. And I think the great point to all of this is, I just say this because last night when my husband said, "So, what's your show going to be about?" And I said, "Well, Dr. Isaac's going to be on, and we're talking about regenerative medicine." He's like, "Oh, like stem cell therapy?" And I said, "Yes, but I think that there's so much more. Like you said, it's so broad. There's so much more to it." And these that you're talking about are therapies that, after the fact, right? In I think a lot of cases, I have a client right now who was in tremendous pain for quite some time because of her hip. And she kept being told that stem cell therapy doesn't work. Don't do it. Don't do it. She finally did it, and it changed her world. And so it's amazing what it can do. But what happens if we go through the regenerative process prior to being so chronic we have to do these big, more invasive procedures? And the thing too that I want to hit on that I think is important to keep in mind is that because 80, 90, 95% of the diseases, the conditions, the symptoms, all of those things that we deal with are lifestyle, it takes it back and puts the accountability on us, on me, on you, right? We can't blame it on bad luck, on genetics, on age, and age happens, yes, but I hear so often, well, my brain's not working, it must be age. Or even last night, my husband said, I'm not sleeping well, it must be age. I'm like, who are you and who are you married to? Like, do I not talk about this all the time? Anyway, but it's not the case. It is a matter of what we put in our bodies, what we put on our bodies, how we talk to ourselves, what our mindset looks like, how we rest, how we stress or de-stress, how we view life, spiritually. So everything matters, and everything has the potential of affecting our epigenome, which affects our gene expression, and then in turn is how we express disease and symptoms and so forth. So taking that step back and saying, this is on me. And it is, and it's the coolest thing in the world. It's on me. I have the ability to make the decisions. I have the ability to do what's good or maybe what's not so good, and that's okay because we're all going to do both. But having the knowledge to know the right decisions to make is key. Or when you're making the wrong decisions, because sometimes we just like, that's what I want to do, and I'm going to do it.
Indeed. At least you can kind of know that, okay, maybe there's going to be some gratitude that I get from this, or I'm going to get some pleasure, but I know that maybe this isn't the lifestyle that I need to live continuously, right? Maybe a little taste of it here or there, but in bits and pieces. So, but, with that reactive approach, and you're talking about, you're in control. Right? I didn't think I was going to go here, but I'm going to because it's the time of year of people looking at their HSA and FSA accounts and replenishing those. And I think those are amazing because you get to choose, you're almost able to hire I look at it as the term of free agent. You can go hire whoever you want to help you with your health because you can use those for nutrition, for chiropractic, to be able to go get the care from the provider you're looking for advice from and direction from without having to worry about what your insurance does. And in the reactive world, that's what insurance is there for, is being reactive, right? Because I broke an arm, I had a heart attack, I have cancer, whatever it might be, that's really what I think it's supposed to be for. Medicare, in their catalog of what they do, and this is what insurance companies follow, they clearly state, I can't remember what the section is, but they say any course of care that's aimed to prevent or promote wellness or prevent disease is not medically necessary. So they deny it. It's like, well, that's the idea of health, is being proactive, not getting in disease, right? Yeah. And so that's what I want to focus on in my office, is the salutogenic approach. I don't know if too many people have heard that, but it's the factors that support health and wellness and being proactive to help your body be resilient versus focusing on the factors that control disease, right? And that's what the medical model is about, is we need to control disease versus address the root cause in your body, which can be multifactorial.
Yes, without a doubt. Well, especially if we don't, I have to say this because this is where so often the problem comes in and why we need to build a team. Because we don't know what we don't know. And we only know what's been told to us so often through big pharma, big medicine, big food, because of the commercials and because of the marketing. Marketing's amazing, and it works really, really well. I have a client who I was talking with yesterday, and it was really basic conversation, basic for me, but it wasn't for her. Eggs. She avoided eggs because they were unhealthy and full of cholesterol. And I opened her world when I said, please eat eggs. Sweet potatoes, she was afraid of sweet potatoes. She was afraid of nuts and seeds. And it's because of marketing, it's because of misinformation and disinformation. And so we've just got so much of that. And so again, taking it back, finding the people who can help you and guide you so you know what the science is today and what is real and gives you the ability, again, to take back your control. Sorry, yesterday I was just like, so frustrating when we
It
have
is,
such
it is.
confusion around
I mean, like,
basic
well,
things
there's
like
the
food.
cholesterol myth, there's small and large
Yeah.
particles that
Yes.
people need to look at, and
Mhm.
so when we look at, I appreciate your view as far as like the factors that you look at as far as or encompass health and wellness, right?
Yeah. Mhm.
But I've kind of broken down certain segments of that,
Mhm.
as
Mhm.
well. So it's, what do you do when you want to get balance in your body? You have to look at your nutrition. You have to look at how you're moving your body, the exercise you're getting, how you're thinking. But then one of the areas that pretty much I'll say nobody thinks about and is super basic, and if you really think about it, is your nervous system, right? Your nervous system, your brain is controlling everything in your body, how your heart will beat, how your hormones get released. If your body's stuck in a fight or flight state, are you going to be more constipated, or are things running through your body too fast, right? And so much research has been done on the autonomic nervous system and how that heart rate variability and how your body deals with stress can impact the disease processes in your body, because we always have, I'll just say, like cancer cells in our body. And it's up to our own immune system in our body to recognize those and go after it, eat them up, and toss them out, right? But if our body's suppressed enough that it can't self-identify correctly, then maybe it's an autoimmune disease, maybe it's cancer that starts growing, maybe it's some other issue. And so the nervous system is so critical in that component of recognizing what's going on within the self, right? Within the body, to be able to hopefully build the right reaction. And the body's so smart. I mean, think of this for a moment. Do you think your toe controls your heart?
That's an interesting question.
Right? Well, what if I step on it? What's going to happen to your heart?
It's going to go up. My
Right?
heart rate's going to go up.
Right? Your body is so smart. There's a reason why your body is giving you a certain symptom, whether it's elevated blood pressure, cholesterol, what hormones are off. There's a reason your body's telling you that. And then if I even use the term estrogen, you think that's a hormone?
Yes.
Well, it's not. It's a class of hormones. Right?
Yes.
It's a class of like estradiol and the other, the 10 other hormones under that class, right? Estrogen itself is not a hormone. Right? And so if you, most common, when people go in to have their blood work done, they'll see that, oh, here's 3 hormones. The insurance company pays for this panel. And wait, what about the other 7 hormones?
Yes.
Right? And it's like, well, if you're making a decision based off of looking at 3 things, and wait, there's 7 more? Well, you're missing more than half the picture, because insurance companies don't pay for those, so medical doctors don't order them, and so people get stuck in a cycle like, well, the doctor told me to take this because I have this, and I still kind of feel like crap.
And you can go beyond that, but same with the thyroid, the same with cholesterol, lipid panels. But then, what are those hormones affecting other parts of the body, right? The rest of the endocrine system.
Totally.
And so if we're not being complete, or as complete as we possibly can, with understanding all of the different systems and the way that they interplay, including the biomechanical system, because one goes wrong, the other goes wrong, and vice versa, it's all affected, and it's all holistically combined for a reason. And so often what we see in conventional medicine is it in pieces and parts, and there's no interactivity of them, which is just, I mean, we have to have our specialties, that's fine, but we have to look at how everything is being affected. When we take drugs affect us epigenetically. I mean, that's proven, and it can have severe consequences. Even simple drugs like ibuprofen, right? So we have to come at health and dishealth at a truly holistic view, again, including all of the things that affect stress, financial stress, relational stress, and it all plays a role in our health today and our health in the future, and of course, as we talk about, in health for generations to come.
And this is an analogy I just heard recently, and it's like, it's so perfect, because people, like, I'll use the example of somebody that has cancer. They go through chemo, right? And so imagine a fireman. Your house is on fire, right? You want them to come in and put the fire out, right? But then there's also a carpenter over here. You wouldn't call a carpenter at that moment, right? But then the carpenter's looking at it like, well, I can't put the fire out, so you need to put the fire out. But when he comes in to look at the house, after the fire's been put out, it's like, well, the walls are ruined. They're soaked. The drywall is gone. I need to like totally redo this from scratch.
Yeah.
And so that's exactly what's happening in those situations when people have cancer or different issues, like what just happened over the last 3 years, right? People are looking at an emergent situation and treating it like they're firemen, right? And they're ruining or really decreasing the health of the individual at a moment in time where sometimes maybe that's what's needed, but other times, how can you be proactive and build health versus just tear it all down and, okay, you got the cancer, but now the odds of cancer relapsing is so high. I'm not sure how many years period, but like over the next 5-year period, there's a huge relapse of cancer rates, right? And so, but if you started to approach it more from the carpenter perspective, you're going to start building the foundational building blocks for a good house, you know, your body, right? It's a temple.
It is.
And so, but if you went in and ruined that temple by dousing with water, it's really hard to build that back. But if you can start from earlier on before you get to that state, then you don't have to worry about the firemen.
You don't want to worry about the fire,
right? So, it's just, how can you be proactive? You need to find those providers that are looking, you know, see if they're walking their talk, right? Is that what I want to look like? Is that what I want to be like? You know, like I see some people in public health and I'm like, how the heck is that person, you know, in public health when they look how they do, you know? There's different things that can be going on for people, but when we're being recommended to consume like lots of grains and other things in the triangle pyramid, right?
Oh,
of food.
What a joke that is.
Right? And it's like we're getting a marketing message essentially because there's subsidies, right? And so you have to subsidize yourself. You have to take care of yourself, right? And critically think. And so people that do tests, like for us, we'll do neurologic tests that we can do in our office and
they have really cool tests in their office,
Same thing like with you, doing a complete blood panel that is getting everything, even the urine and other areas, right? That's like, insurance doesn't cover it, but you need to know what's going on with your body so you can make the right choices for it versus only having half the story.
Yeah, I want to say this just as an example for those who may or may not know, but when we're looking, when we run a lab, say for instance, a thyroid panel, what I hear from people who I talk to are, we ran my thyroid panel and it looks just fine. Well, it's 1, 2, or 3 markers when I'm testing 9, maybe 10 markers. And so that's what I mean, or that's what we're talking about, is there's always more to the story, and there's always more ways of putting pieces of the puzzle together so we can get a more complete picture of what's going on. It may never be totally complete, but we can get more complete, dig deeper. That's always the goal, is to dig deeper. With a lipid panel, it's not about HDL, LDL, and triglycerides. Yes, that's a part of it, but that's just it. It's a part of it. It doesn't tell me anything about your inflammation. It doesn't tell me anything about what the particles look like, which is what makes such a difference in how they're reacting in the body. So just want that to be super clear. I want people, and I say this a lot, but understand that you always have to ask why. If your HDL is elevated, which nobody ever cares about that, but I do, then ask why. If it's not high enough, ask why. If your LDL is elevated, which is not usually a bad thing, I know that's not what we hear, but ask why, and find people who are going to dig and take the time to dig for you. If you're having a pain in your back, if you're having chronic constipation, see me, see somebody like Dr. Isaac. You want to work together, because I might be able to help with some things, and he'll probably almost always be able to help with some things. So really taking into consideration what it is that you can do to look at the whole picture.
Definitely, that is so important, because certain factors, you might be good on your exercise, you might be good, you know, with your sleep patterns, you might be good in certain areas, but your body, I'll just use an example of a doctor I was talking to the other day. He was like, I'm allergic to eggs, even though eggs are good for you, right? And so he said, well, why don't you just eat an organic egg? You know, like, well, I'd be organically dead, right? And so what's good for the goose isn't always good for the gander. And so we have these different philosophies that it's like, well, hold on, that's not, it might be right for you, but it's not necessarily right for this other person. And so definitely having that team to help you figure out what's right for you, and do the right tests. It can mean a world of difference.
It can. It can mean a world difference, and it can. A lot of the things that we do just aren't found in the conventional world, which is okay. They do things that I don't do. A lot of these specialty testings. But when it comes to the true basics and really understanding how a body is functioning, it's looking at we should talk a little bit about the testing that you do in your office.
Sure.
And then, the things that I do as well on a more, biochemical basis. But yeah, let's talk about that a little bit, because it's amazing what you can find out when you watch your heartbeat.
Yeah, totally, it is. Let me get to that in just a moment.
Okay.
I want to tell you a personal story. I went to have my annual blood work done about a year ago, and I went to just a regular doctor, a medical doctor who, like family medicine. I don't really have one because I don't really ever go to them, but my wife was like, you need to go do it. I'm like, and I was there, he's like, well, thank you for being so healthy. You made my job so easy. I'm like, why am I even here?
Yeah.
I should be going to somebody like you or a naturopath or somebody that's like more in tune with. I don't want just a high level look. I want to like get down another level or two to find out what's going on more functionally with me versus just from the surface level. I don't have any symptoms. Well, you're great then. It's not just a mere absence of symptoms that I'm looking for.
Yeah.
Right?
Yeah. If you're healthy like you are, but you truly want to optimize and you want to avoid what could happen in the future, you're looking at your micronutrient deficiencies, or maybe if you have micronutrient sufficiencies. Is that correct?
If there's sufficient levels.
There's no. Anyway, you want to understand your microbiome, which affects your immune system and affects your mental and emotional health. You want to understand, if there are inflammatory markers, because maybe you don't know that you're inflamed. And why would you be inflamed? So you got to dig. So, even just like, you're talking about, being proactive, that's what proactive health looks like, is still digging, still understanding, and having those baselines. So, if there is something maybe that's out of whack, you test it again, and you test it again, and maybe you test it every year. Anytime I see somebody with elevated homocysteine, which I rarely see tested in conventional medicine unless they're older and going to a cardiologist, and I see it elevated all the time. And people who are young, it's usually just because of nutrient deficiencies, but people who are young and it's over a certain number is a 100% chance of cognitive decline, and I see it over 11 all the time in young people. And so understanding, and that my point to that was every year. Test it every year. Once we get it at baseline, where it's supposed to be, test it every year. And, having that information is gold.
Yeah, there's the big difference between pathologic ranges versus functional ranges. And functional ranges help you be more proactive because they're catching things earlier and letting you know that information. Just like the test that you were alluding to earlier in my office, we'll do a heart rate variability test, which tells us how well your body is dealing with stress. We'll do a thermal imaging test of your body as well, which the thermal tests look at blood vessels. So one side's warmer, the blood vessels on that side is going to be more dilated versus the other side is going to be tighter, more constricted. And so when we see that, those nerves that go to the surface of the skin also go to your lungs, go to your heart, your intestines, digestive tract, go to glands, all these other areas in the autonomic nervous system. And so if we see problems there with that, then it's like, hey, it's not just, say, neck pain or back pain. We're looking at your body from a holistic point of view of like, your body's not getting healthy signals here. It is in a state of stress. And stress leads to disease or dis-ease. Or it's not ease, which leads to disease, right? And so then we'll also do a surface EMG scan as well, and these give us great information of ways to look into the body and how it's functioning on the inside, exclusive of any symptoms, right? And so I had somebody come in with his wife yesterday, and he was like, I just came because she wants company, but he went through an exam with us, and he was like, I could tell he was like, I don't even know if I should be here, but I'm here to support her. I was like, hold on, why don't you just get up, stand on these two scales, 1 foot on each scale. And he was 30 pounds heavier on one side.
Amazing.
Right? It's not like his right side of his body was 30 pounds fatter. It's just that his body was compensating on the inside. And it came out that he's been having some issues, but, you know, kind of in that macho way that I think a lot of people deal with. You know, like, if I'm not broken, why fix it, right? But I've had some issues, but that was just like some insight, like, wow, I can see how that's going to impact things. And his wife had gone through knee surgery. She had the similar thing, but it wasn't quite to the same extent. But if you imagine knee issues, back or hip issues, or even in the back, if you're putting 30 more pounds of weight, it's not just on the joints, it's also on the nervous system. So if the one side's getting way more stress, it's impacting your digestive tract, or your kidney, or a liver, or wherever else. And so those are the scans that we like to use in our office because they're less invasive, and we can do them periodically without having to use radiation through an X-ray per se, to be able to get that more inside of a view of what the body's doing, you know. And so those are the tests that we like to utilize in our office to help with figuring out where somebody's at.
Yeah, it's so important, and something I have to do because I can't believe we're already, it's 10:48, 10:49. As I got to do a quick shout out to our sponsor. It's like we're just going and going, and it's the best thing in the world. Shout out to our sponsor, Cellcore Biosciences, because I love them and everything about them. They are unique in their approach. They're unique in their delivery system, which makes them very, very, gosh, my words are escaping me today. They do that a lot. I need to come see you.
Somebody.
Makes them very, gives them the ability to dig deeper into the cells, into the mitochondria, and allows the body to function at a much better level. And so when we're doing that, the delivery system guides the nutrients in the supplements deep into the cell, which gets to the foundation of health. They're unique in their approach. I love what they do, and I appreciate them because they are digging for the root cause and addressing the root cause. And sometimes it's so deep that we don't really quite understand why, but that's what this does. And I love that about them. They work so well. It's pretty phenomenal, the changes that I see in practice. And so I appreciate them. You have to find a practitioner in order to order any of their products because they are very strong. And it takes getting to know them to really truly understand them and use them the best you possibly can. So anyway, I sort of screwed that whole thing up, but that's okay because that's what I do. But you can go to my website, but you can go to Cellcore Biosciences. I think it's just cellcore.com, and you can find practitioners that are near you. Of course, I work remotely and virtually, so you can always reach out to me. Happy to answer any questions about Cellcore and anything else. So let's move on away from that terrible shout out.
No worries. But like just to a few of the things I usually try to tell people about, you know, like sleep. You know, sleep is so important and vital for our bodies to regenerate and heal. You know, like keeping your room dark, keeping it cool, keep like EMF exposure from your cell phone or a modem router out of your room, right? Maybe if you have your phone as a alarm, at least put it on airplane mode, right? So you're turning off those signals coming into your room. You know, and just being consistent with your sleep schedule, you know, and also movement, right? Try to get at least a 15-minute walk in every day, right? Get the heart rate up. It's good for the mind. You focus better after that exercise. But don't sit for more than 60 minutes as well, right? You just try to get up and move around. It's so critical and important for our bodies to do that. And, you know, with nutrition, there are so many things that can be considered with that because everybody has a little bit different kind of epigenetic makeup through their DNA. So there's some general rules of thumb, you know, like avoid decreased sugar intake, right? I think that's goes for everybody, right?
Yes,
and,
without a doubt.
Yeah, it all adds up. And so there's, you know, eating your vegetables and your fruits and making sure you're getting healthy fats. Fat is good for us if it's the right kind.
Please eat your fat, good healthy fat, not canola oil.
Yeah, and also, you know, like the meats that you're consuming, right? There's meat is important. There's no society that's ever gone without any sort of meat product or animal fat or protein in their diet, right? I think it can be beneficial maybe in a short period of time to do something that's like a vegan diet, but their blood work, I'm not sure what you've seen, but from what I've heard, no vegan blood work looks normal.
It's not good. I mean, when you're missing nutrients by not eating something, it's pretty basic.
Yeah.
You got to eat the meat.
And for me, I guess I have more empathy for humans than I do for animals, right? And I can understand somebody wanting to like avoid harming an animal, but I mean, look at, like, try to do no harm to yourself too, right? I mean, if you can't take care of yourself, then how can you take care of those around you? It's
the truth, and that's a really good point, and something that is, something we should probably hit on real quick, because so many times I think a lot of people, and I think women do this a lot, and and I know men do too, and so this is not a conversation about sexes, but we find ourselves so often, and I think maybe even as practitioners, we put the patients first, we put the clients first, we put the family first, we do all of these things, we tell people what to do. Are we doing it? Hopefully, but not always. I mean, I know as entrepreneurs, it can be difficult to do all of the things, and so you're doing all of the other things, and you're putting behind eating the good food, getting out and moving, walking the dogs, enjoying life. Right, and it's got to be at the forefront. You have to watch out for yourself. You have to build your own team. You have to build your own trust team, and allow yourself the time to care for yourself. If you're a mom, a stay-at-home mom, if you're a stay-at-home dad, take care of yourself. You have to take care of yourself, because if you don't take care of yourself, then you're going to end up not being able to take care of the family.
Indeed. I think when people actually get down to it and they experience a crisis in their health, that they all of a sudden realize at that point in time, oh, my health is probably my best or greatest asset, because people go bankrupt. That's one of the number one reasons people go bankrupt in our country, is because of a medical emergency or a health-related crisis. And it's just so disheartening to see how we're being led through media and Western medicine to be reactive to our health instead of being proactive and getting ahead of the bullet that could be the bullets flying around in our world, because we live in a much more toxic and stressful world, which leads to more disease. So you need to be more proactive and aware of what you're consuming, what you're rubbing on your body, how you're thinking, and how you're moving. So many people are sitting in front of devices and computers nowadays that they're not getting the needed movement, which is important for normal brain health and function, right? And so it's, you have to be your own advocate. You can't be sitting on your butt all day. You have to get up, right? You have to have that motivation to be your own advocate, or else, I mean, my kids, I don't think they really listen to me too much, but they watch what I do, right?
Exactly.
They learn through what we do, and so how can you be a good role model for those around you? Is leading by example, talking about the different things, and I think especially over the last 3 years, we've really became more aware of needing to be proactive and not reactive, as far as what can I do to take back some of my own power, to be, in charge of my own health, right? And, through nutrition, through brain-based chiropractic, through other avenues, working with a personal trainer to get more fit and metabolically flexible. All these things are an important part of that pie that you may create for yourself, to say, these are the things I'm doing to be proactive for myself. And that's the biggest message I think that I want people to have and take to heart, is how do we do this? What are these avenues besides, oh, I eat well and I get exercise? Well, quote unquote, what's eating well for you? Have you been tested? What's the right exercise for you, right? Women probably shouldn't do weight training at certain times of the month, right? Because it's going to tear their body down more than it's going to build it up, right? And so everybody has a little bit different, I'll call it a cycle, right? We all do. I mean, and so like men, they have more testosterone in the mornings than the after evenings, right? And so their bodies are more designed to handle certain stresses compared to women. They're meant to be more lovers and nurturing, right? And so you need to find where you're at and how your environment is impacting your body, but how you can be proactive to help guide yourself and your family towards health versus being reactive.
I have a client who is a very healthy And she is. I mean, she works really, really hard at being healthy. She exercises regularly, but I don't think she over-exercises. She eats really well. It's all of these things that she thought she was doing well, and has had a mad case, like an overnight case. It's very interesting, of ulcerative colitis. And so, we're still in the process of kind of digging and understanding, but it's that, again, when you think you're doing it all right, are you? And find out and dig. And again, to be repetitive, be proactive. Because we don't always, we think, for me right now, I think I feel really good. I'm pretty healthy. It's time for me to get my labs done. I need to make sure that what I feel is actually what's going on, and if something's out of whack, then I can go and I can take care of it. But it's so interesting, a case like that who comes in, who is tall and lean and healthy, and she looks amazing, and she's like, my body is going haywire. And it did go haywire for months, the poor thing. So just knowing it can happen. It can happen any day, so be on top of it.
Yeah,
sure.
I mean, like, I'll use the example of somebody that had took a drastic reaction to the MTFR. And wait, is that
MTHFR?
Yeah, that gene. Like, she found out she had it, and she chopped her tatas off. It's Angelina Jolie.
Oh, that's
right?
the BRCA gene.
Yeah. Oh, okay.
That's
the
BRCA
BRCA,
gene.
but
Yeah.
it's like you tend to have so much influence over your body and epigenetics that why go to that extent if you are aware and you have the knowledge of this? These are the things I can do to control and help my body avoid having that mutation. Yeah. Right. Even though I might be prone to it.
Well, it's the mutation expressing, right?
Yeah. Exactly. Indeed. So, but that goes for so many different things. Just because you had a family that had back problems, right? That's not genetic. No. But so many people are like, oh, my migraines are genetic. You know, or this is genetic.
My cardiovascular disease is genetic, and my diabetes is genetic.
Or your high cholesterol is genetic. There is something about that, but there's like less than 5% of the cases out there actually have that. And so many people like use certain things as crutches because it's convenient for them, right? Ignorance is bliss to an extent. But don't stop digging.
No,
right?
You're right. You have to keep digging. And I want to go back to one thing. It's a little past topic, but I want to, when we're talking about taking care of ourselves and being proactive and making sure we're living a life that allows us to be able to do all the things that we need to do, what I hear all the time, and I was there too, and I'm sometimes still there, but so much of what we need to do to help to calm our bodies is to take that time to be still. And that can look like meditation, it can look like prayer, it can look like music, but it's literally being still and being alone and kind of emptying. And not everybody agrees with that, but it's, for me, it's talking to God or allowing Him to talk to me. But so many people say, I can't, I don't know how, my mind moves too much. And I'm going to tell you, everybody's mind moves too much. Everybody. So this is a place where I'm going to say that doesn't make you special because everybody's that way. So it takes a true commitment, and I haven't been truly committed until recently, and I'm still floundering a little bit when it comes to that. But it's an amazing thing when you, and an amazing biochemically how it changes the body, changes the mindset, changes your nervous system to be calm, to allow you to deal with the things you have to deal with, to find clarity and to find focus. If we would all take that time, even, I tell my clients start 5 minutes in the morning and 5 minutes in the evening. I don't care if you're in the shower. Sit in the shower for 5 minutes and just sit and be still. It can change a world, a life. It can help with the disease process if you're going through that. It can help with allowing for adjustments to hold. It's just amazing stuff. So don't take the attitude that you can't, because you can.
Yes, indeed, you definitely can. You are in control, right?
That's
and the biggest thing, or one last thing I'd like to add is that we just did, a lot on epigenetics in with preconception care, right?
Mm-hmm.
And we just did a little mini class on
we
that,
did,
right? And
yeah.
so that was fun.
Mm-hmm.
But I'll provide that link to my site in the show notes and then I think you also have a course that you're offering as well. What is that on?
Soulful Conception.
Awesome.
So moving through that, doing webinars every couple of weeks on that to give some information, some good stuff out to people. So the preconception planning and care is integral to creating a healthy body, a healthy baby, a healthy pregnancy, and literally a healthy future for generations to come. And that's the message is let's create a healthy future because we can, and we have the power to do it. So,
but people just need to be aware that they need to start thinking of these things well ahead of becoming pregnant or trying to get pregnant.
Right.
Yeah.
We're running over, so not that it really matters, but so tell everybody how to find you.
The best way is through our website, and you can find our social channels that way as well. But it's Lifetime Wellness Chiro.com, or another way, same website, just a different name, is Denver-chiropractor.com. So that's not spelled out with a hyphen; it's just a symbol.
Just a symbol.
Yep. But that's the best way to find us.
Cool.
Yeah.
Very good. Check him out. Good stuff. Good information. He's got a lot of good information on his website for those of you who maybe not be local. I do have connections across the country as well, so you're more than welcome to reach out. I'll chat with people over the phone as a complimentary consultation as well. Cool. So I'm just here to try to help point you in the right direction. Yeah, I mean, that's really all we want is to be a resource and be helpful for you. If you want to come see us, great. If you want to see somebody else, great. But we want you to find what's best for you. And it's just to be of service. And that's what this show is about. It's just to have fun and be of service and bring you good stuff and good people. So, of course, you can find me at tastelifenutrition.com. You can fill out a free assessment online, and I'll reach out to you personally, and we'll chat about it. And we'll see if I can help or if someone else needs to help or if you can do it on your own. That's all fine and good. But want to at least give you the good information and, working virtually with all clients at this point. So I see clients in states and outside of the states, which is super cool. So all of the social media is Taste Life Nutrition. And of course, Soulful Conception. You will continue to hear more about Soulful Conception and preconception care and planning. It's super cool. So
indeed it is. And I forgot to mention, because I mentioned Evergreen, my wife's a chiropractor in Evergreen, so we have an office there called Get Moving Chiropractic. Yep. And so she has a pediatric pregnancy focus. But then my office is in North Cherry Creek in Denver. So I didn't mention that, so I just wanted to make sure I dropped that.
Yep, all local peeps. Yep. But everybody is here to help you find your best self. So we will see you next week. Have a wonderful week and a wonderful weekend. And check us out next week, 10 a.m. Mountain Time. See ya.